So I'm delighted to introduce today's speaker, Sylwia. She is a qualified manual lymph drainage therapist, trained in Dr. Vodder's method, a level 5 sports massage therapist, and an oncology scar specialist. Her passion lies in supporting people with lymphedema, especially those affected by cancer treatment. Today, she'll be guiding us through the essentials of managing lymphedema, from understanding the lymphatic system and recognizing early signs to self-care tips, manual lymph drainage, and when to seek professional help. Whether you're a patient, a caregiver, or a healthcare provider, this session will be full of practical advice that hopefully can make a difference to anybody who's watching. So, Sylwia, we are thrilled to have you with us, and over to you.
Thank you very much. Good evening, everyone. Thank you for joining us. First of all, I just want to say I'm a little bit nervous. It's my very first presentation, so excuse me if I stumble on the way a little bit, but I will try to provide you with really helpful information that whenever you feel like you need to seek assistance, you know where to go, whom to see. So hopefully you will find it beneficial for you today's session. What I will do now is I will just share my screen with you. There are some slides, and just give me 1 second. I will quickly do it. Right now. Yes, can you see my screen? Hopefully you do.
Yeah, it's good. It's good. We can see it.
It's good. Lovely, lovely. So just a couple of words about me also. I do work with oncology patients in a clinic in London. I do treat lymphedema. I do treat post-op swelling. The main people that I see, my patients, are women with breast cancer related lymphedema, but I also do see patients with head and neck swelling or lower limb swelling. That's what I do every day for 4 years now. Okay, let's go to slides. What I would like to start with is to introduce you to what lymphatic system is before we go and start talking about lymphedema. We need to know how this system works, just to understand what is lymphedema and why does it happen and how we can manage it. So lymphatic system is a network of organs, lymph vessels, and lymph nodes. And lymphatic system is a crucial part of immune system. And the way the lymphatic system works is every time when oxygenated blood gets into cells to bring nutrients and oxygen, those cells are giving back like waste products. And these, in a form of lymph, are being gathered in like interstitium, so in the space between the cells. And this very lymph is being collected by lymphatic system. So lymphatic vessels are gathering the lymph and transported through the lymph nodes all the way up to where the lymphatic system joins with venous system above the clavicle. And this is right lymphatic duct and thoracic duct. And in this very place, lymphatic vessels joins again venous system, lymphatic system joins venous system, and then again it's being circulated again, and whatever needs to be taken away from the system, it is, and everything else is being circulated again. What is important to mention about lymphatic system is that this is a one-way system. So it doesn't circulate like blood circulates in the body. It goes one way. So from your little toe all the way up to above your clavicle. And it doesn't have its own pump. So it really relies on muscle movement, really relies on like arteries pulsation. So that is the reason why it's very important to be active, to exercise, to walk, to swim, just to make sure that we do have an impact on the lymphatic system, that we help to push the fluid up against the gravity. And this is quite an effort for the lymphatic system to go against the gravity. Yes, super important to be active. Very something worth to mention is that the lymphatic system doesn't really contract often. I mean, the vessels to push the lymph up, it's a very sluggish system. It's like 4 to 6 contracts per minute. So by being active, you do really help a lot the system. And so I talked about like everything below the clavicle, collarbone. So head and neck obviously has really like short way to connect with right lymphatic duct and with the thoracic duct. So this is how lymphatic system work. Like I mentioned before, it's a crucial part of immune system. So when the lymphatic vessels transporting the lymph and when they are passing through the lymph nodes, I call the lymph nodes like police stations, where white blood cells, you know, are picking up the pathogens, etc., and they just do their job. And the best example of to see how it works really is when you have a sore throat or cold and you see these lymph glands on your neck enlarged. This is the sign that something is going on in the body, some sort of infection maybe. So this is when the pathogens, bacteria are being picked up by the lymphatic system. So this is how it works. And if or when our lymphatic system doesn't really work properly, this is when we can see in our body some sort of swelling. So every swelling in the body has a reason. It's not like it just happened with no reason. It definitely does have a reason. And if you ever happen to notice that you present with any swelling, then definitely do go and check with your doctor. Because like I said, there's always a reason for this to happen. And so in that case, having said all this, knowing how lymphatic system works, so what is lymphedema and how does it occur? So lymphedema, if I wanted to just describe it in a one word, is swelling. Lymphedema is swelling. So something is going on to the lymphatic system that we present with swelling. Lymphatic system is somehow affected and really it doesn't work to its full capacity. It struggles. Something prevents it from working well, and hence the swelling. And sometimes we can call it also like chronic edema, anything to do with lymphatic system failure. It is swelling, it is edema. However, the reasons for it to happen can be different. And if we talk about oncology patients, the reasons for swelling might be lymph nodes removal, lymph nodes biopsy, oncology treatment, whether it's radiotherapy or chemotherapy. So there was some disturbance to the lymphatic system in form of said biopsy, lymph node biopsy. And the system might find it difficult. It will still work because oncology patients has still, even the biopsies being done, plenty of lymph nodes remaining. So having lymph nodes removed, it doesn't mean that you are guaranteed to develop any swelling. However, the moment this happened, you become at risk. But I will go to this in a second. I just want to also mention that when the swelling, the lymphedema, is being picked up early enough, it can be very well managed. It can be very well managed. And by saying quickly picked up, I mean if the patient realizes what are the symptoms of something not right going on in the body. So before any swelling shows off, there are some symptoms. And these can be the sensation of like heaviness in, say, right upper limb, a sensation of like inner pressure. And just simply if one of your upper limbs, for example, doesn't feel the same like the other one, this might be the sign that something is going on with your lymphatic system, that it struggles and it needs some assistance. And saying this, I just need to make you aware that if you ever experience anything like this, or you hear someone does experience something like this, these patients must be seen by the doctor first, just to rule out, for example, DVT, because this might be one of other reasons of swelling happening in the body. And there are also risks that can put patients, that they can experience swelling, and they are not like oncology related. This can be age, when patients at certain age and don't move about too much, and we can observe some swelling in legs. Obesity is also one of the risk factors for swelling. Some skin conditions like bacterial condition like cellulitis, this also might trigger swelling. Accidents or venous system affected, a lot of like varicose veins, these also can contribute to some swelling going on in the body. But like I said, when it is picked up quickly enough, it can be managed really successfully. If I would see here in my practice patient with a little bit more advanced swelling, there's also treatment for this. So it's not like there's no management for it. There is, but it very much depends when patient picks up the swelling. And it's also worth mentioning that swelling can occur in any body part. But when we talk about oncology patients, it usually is in the area of where the lymph nodes were removed or where the radiotherapy was done. So say for breast cancer related lymphedema, it will be either the site, affected site, so chest part, breast, or arm. For like gynae patients, this could be legs, because lymph nodes in the groin area are being removed. So it's usually this part. But like I mentioned before, it's really important to always double check with your doctor, with your oncologist, and just confirm that there's no other factors that made or can contribute to the swelling. So again, why lymphedema happened, I think I've just more or less say, it happens when lymphatic system is affected. Somehow something happened to it, it's damaged, it's blocked, there was biopsy, radiotherapy, there's some disturbance to the system. This is when the swelling might happen. But I also want to make it clear that it may not happen at all. So patients undergoing lymph node biopsy or radiotherapy, it does not mean that they will definitely develop lymphedema in their life. this treatment puts them at risk, but it doesn't mean that they will ever have it. What I always try to, I try to make sure that my patient understand and they do realize what are these symptoms before any swelling occurs. So when this happens, they are not like afraid of what to do. They just know, okay, this happens, all right, I need to go and talk to my doctor, and then I need to probably go and see lymphedema therapist after checking with my doctor. Because there is nothing probably worse than just observing these, than observing swelling coming up and doing nothing about it. So the action definitely must be taken. What is also worth mentioning in terms of oncology patients, that well, actually not only, but in general in lymphedema, we have staging of severity of swelling. And those patients that I've been just talking about, those who should pick up those symptoms before even any swelling occurs, these patients are usually like with subclinical lymphedema. So no swelling is visible, but your system is letting you know that there is something not quite right, and your system needs assistance. And this is what it is. This is like asking for assistance. And this is where the treatment comes in. But to the treatment, I will just go back in a second, because I just want to also mention that lymphedema is not only as a secondary lymphedema that is caused by something, but we also have many patients with primary lymphedema. And this is when the lymphatic system has not been developed properly, and the child is being born with affected lymphatic system. And it might really occur quite early, or might really kick off later, 20 years later, later in time. So in both scenarios, primary and secondary lymphedema, there is some sort of imbalance in lymphatic system itself, and hence it just presents and manifests as a swelling. And now we can move on. Oh, this is also important. I just want to also mention that everything I'm saying today here is based on my experience with working with oncology patients and working as a lymphedema therapist. So everything I say is based on my experience here in the clinic. I just want to mention about what is the difference between post-operative swelling and lymphedema, because this is also a swelling. We are talking about swelling, but it's a little bit different to what lymphedema is. The reason why is because lymphedema is like a chronic condition. So it's a condition for lifetime. Again, it can be managed successfully, but this is what it is. There is no cure for lymphedema at that moment. Whereas post-op swelling is a part of healing process. So when there is a damage to the tissue, when there is some trauma in form of operation, the swelling is there, shows up in this area to kind of like protect the area, to enhance the healing process. So this is very much natural situation. Sometimes I have patients here in my clinic saying, is it lymphedema? Why am I? It's been a month or 2 months after my operation, after mastectomy, for example. Why do I still have the swelling in my breast, for example? So this is what I explained. This is absolutely normal swelling. It might be even 3 months with the swelling being there. What we need to be aware and observe is just whether the swelling is like decreasing within the time, which it should, and that's the only thing really we need to observe. And when I have my patients here in a clinic who are just right after post-op, manual lymph drainage is a perfect treatment for them to like enhance lymph flow. Like I mentioned, it's a very, very sluggish system, lymphatic system, and sometimes it does need assistance just to help to pick up the swelling and distribute it. And manual lymph drainage is really good. It's really, really helpful. And like I mentioned, post-op swelling is just a temporary. It's temporary. It's short term, and within the time everything subsides and everything go back to normal. In terms of lymphedema, it's something different. We are looking into. It's different to post-op swelling, and there are different like management ways to deal with this. Okay, let me just. I think I've already mentioned before here, like what interference in lymphatic system can cause. Like I mentioned, disturbance. So lymphatic system will work absolutely fine, even though it's very sluggish. But the moment something's going on, it just getting a little bit confused, hence the swelling in the area. But again, for someone who's at risk, it doesn't necessarily need to, the swelling doesn't necessarily need to show off. Lymphedema doesn't really need to develop in these patients. But it's really important that you bear in mind those signs and symptoms, again, like heaviness maybe in a limb, inner pressure. Maybe you notice that your watch is being a little bit tighter on your wrist, or maybe your clothes are getting a little bit too tight. These are all the symptoms that lymphatic system is struggling to drain from this particular area. And it definitely needs some assistance. All right. So this is what I've just mentioned here, like new aching, tingling, numbness, discomfort, anything that is not normal for the patient, for oncology patient. This is when the patient should seek doctor's attention, and then later, ideally, qualified lymphedema therapist attention. And now I think we can move on to what the treatment is and what manual lymphatic drainage is, and what is the management of lymphedema, management of swelling. So like I mentioned, the early intervention is the best. The system needs just some assistance. The form of manual lymphatic drainage, the form of self-massage, the form of maybe light compression garment. This is something that enhances the system to work and hopefully prevent the further swelling. Manual lymphatic drainage is something I do here in a clinic every day. I treat my patients with manual lymphatic drainage every day. What this treatment does, knowing that the system is one-way system and it's very sluggish, manual lymphatic drainage with its very gentle skin movements, it's a very delicate technique, skin movement. Some people call it massage, fair enough if they feel it this way, but it's a skin technique. When you stretch the skin, knowing that you are stretching the lymph vessels underneath, because these are what we want to target. There is, of course, a deeper lymphatic system, but we target the superficial one. And those gentle movements just speeds up the lymph flow in the body. So instead of lymph vessels contracting, I don't know, 4 to 6 times per minute, they are contracting, say, 10 times faster. And manual lymph drainage aims to distribute the swelling from the affected area. So if, for example, we have a swollen arm, we just need to use these techniques to push almost the fluid away from the area, distributed it to where it should go. We would open non-affected sites, lymphatic nodes, and we'll just make the system to work more efficiently, just to deal with this, deal with the swelling. And what I also try to do here in a clinic with my patients is to encourage them to self-massage. So I do show them techniques of what to do and how to do to enhance the lymph flow, encourage them to do the massage at least every other day, and definitely do encourage my patients to exercise, to swim. Don't hesitate. Knowing that you have, for example, lymphedema in your arm or in your leg, this really should not prevent you or stop you from being active. Of course, when if I had a patient with like severe lymphedema, then it's probably a little bit different approach to or what the patient can do. But in general, being active, physical activity, when your muscles are working and pumping the, lymph up to where it should go, it's very, very, very beneficial. So manual lymph drainage is a part of like whole decongestive therapy. Manual drainage on its own probably is not as effective as in combination with decongestive therapy, which is compression garment or bandaging, again, if the situation is a little bit more severe, if the swelling is more severe. But if we're talking about, let's say, subclinical lymphedema or even stage 1 lymphedema, which is when patient experiences swelling, for example, in the morning or during the day, but in the evening or overnight it subsides. So patients wake up with no swelling, but then again throughout the day, lymphatic systems just struggles to pick up lymph from the area. So for these patients, compression garment, temporary, it's very, very useful. And I always mention this to my patients, like, because they're quite afraid, thinking that, oh my God, now I need to be wearing this sleeve forever. And I say, no, you don't. This is not necessary forever. Again, based on what stage patient is. And if I know that patient needs this sleeve only for just a period of time, just to assist the system to pick up the lymph from the area, then that's it. Then all the patient needs to do is just to leave this compression garment in a drawer somewhere and keep it there for just in case this situation happens again. And it may not, but it might. So I just want my patients to be ready for it, and I don't want them to panic, because if this happens again, even if it was 6 months or so, they just immediately know what to do. And I always tell them, even if you notice that there is so much better now, that the swelling went down and just no sign of it, etc., I always encourage them to remain physically active. And I always encourage them to do self-massage, even if it was only twice a week, but do it. And to be fair, I would encourage everyone to do lymphatic drainage really for them. You don't need to necessarily have lymphedema or any swelling to feel benefits of self-massage or lymphatic massage. Everybody really should be doing this. By saying everybody, I just want to mention that, of course, there are some contraindications to manual lymph drainage, But when you meet with your therapist, you will be you definitely will be, you know, we will go through assessment, etc. And symptoms like acute infection, for example, very severe heart condition, very severe kidney condition. These are the conditions that you really look into thoroughly, and if the patient presents with swelling having these conditions, it is really crucial for us to and for the patient to double check with the doctor, with their doctor, whether or what approach should be put in place to assist and to help. Because it might be that no lymphatic drainage is being done, but only compression garment, for example. But again, with these severe cases, I would say it's definitely important to make sure that this is safe for the patient, and no one really should hesitate to double check this with their doctor, nor therapists should hesitate to just, you know, seek an opinion of patient's doctor. And yes, I've mentioned a couple of times about the about seeing like qualified lymphedema therapists. It's very important for oncology patients to, if they know that they need some lymphatic drainage massage, to find someone who's qualified to work with oncology patients. And the qualified person will not hesitate to show your diploma, and you have right to ask as a patient, like, what qualifications do you have? And I always send my patients to, if my patients don't really live nearby, when they come here for a couple of treatments and then go back home, some far away from London, I encourage them to also go to MLD UK website, MLD UK. This is like a register for all qualified, I mean, maybe not all, for qualified lymphedema therapists. And this is a voluntary register. So I believe not every therapist is, every therapist's name is there. But those who are, you can check with their qualifications, and it's very important, because lymphatic drainage that you hear about, that you can have in, like, for example, in a beauty salon, it is a little bit different to what you as an oncology patient should receive from qualified lymphedema therapist. And the reason in difference is that it's just not the same pathway of drainage for oncology patients, for who's had impaired lymphatic system. The pathway is not exactly the same as for patients with lymphatic system intact. So this is very important. MLD UK will give you a register of qualified lymphedema therapists. There is also another site that patient can go to and check. It's British Lymphology Society, very, very informative website, and there is also a register for lymphedema therapists there. So if patient has any like concerns, not sure whether this therapist is qualified enough to work with someone with impaired lymphatic system, they can either ask the therapist for what qualification she or he has, or double check on MLD UK or British Lymphology Society website. But when we talk about the treatment of lymphedema, I just want to go back and just mention a couple of things. Skincare. very important. When a patient presents with lymphedema or is prone to lymphedema, skin care is crucial, because any skin cut, any skin opening is just a portal for bacteria, really. And because the system is already weakened, then the healing process is longer in this area. Then it's just easier for an infection happening in the area, such as, like mentioned, cellulitis, which is bacterial infection of the skin. So skin care, very important. Movement, like I mentioned, just to stimulate muscle pump. Weight management, quite important. It's really important to understand that obesity might also influence swelling, because if you think of fatty tissue that is being like deposited in the areas, say, of legs or arms, it really presses on those very gentle lymphatic vessels and prevent the lymph flow, really. So it's very important to keep your weight well managed. It may not always be easy, but it's important to do. And if oncology patients or other patients, people with lymphedema, are struggling with weight, keeping weight stable, I believe that they might find some help in, like, nutritionist, just to make sure that they do what they can to keep like a healthy weight. Some additional treatments can also be done for lymphedema, and this is like medical taping. So, like, sportsmen are wearing those colorful tapes over their joints, for example, when they're running. This is a similar tape, however, it has a little bit different properties. And from experience here in my clinic, I've noticed that it is very helpful. It is really helpful for breast swelling, breast edema. So I don't hesitate to tape my patients as long as their skin lets me. So unless I have someone with super sensitive skin or very, very fragile skin, then I might not do it. But otherwise, it can be really helpful. What are other oscillation, like deep oscillation? This is another treatment that can be used alongside with your lymphatic drainage massage and alongside with the decongestive therapy, which is like bandaging or compression garments. Also, in my clinic, I think it's worth mentioning, I'm heard from a couple of my patients about the some surgical interventions in terms of helping lymphatic system and in order to help decrease the swelling in the area. And one of them is lymphatic venous anastomosis, and the surgery is to connect lymphatic vessels directly to venous system. I can't really comment on it whether it's very successful or not, but this is one of the interventions, and I'm pretty sure this can be discussed with your oncologist, with patients' oncologist. Should patient really need this assistance? I've also heard of like a lymph node transplant, but again, I haven't heard enough to make a comment on it, whether it is successful or not. So yes, these are these are these additional interventions that can be used to help with lymphedema. There are organizations in England and really all over the world that can provide patients with massive amount of information, really, with regards to lymphedema, again, how to manage it, whom to see, what are the latest, what latest is available for the treatment. And these are, again, British Lymphology Society, MLD UK, Lymphoedema Support Network, Lymphoedema United, and probably there's more, but these are most known to me. And there's one more thing I would like to mention that has a little correlation really to mentioned before, obesity and lymphedema. Sometimes it might happen that these two conditions happen at the same time. So lymphedema because of obesity, and yes, like I mentioned, this is something. So this lymphedema is triggered by obesity. But the other thing, actually, I wanted to mention, not this one, it's lipedema. That sometimes it might be taken as a obesity, but really it's completely different condition. It's just not. It's not the fatty tissue. Fat tissue. It's just being gathered on the tissue in a very specific way that no exercise really can get rid of it. And this again can make patient look like if they've had massive swelling, but this is something different. This is a fatty deposit, and similarly to lymphedema, unfortunately there is no treatment for it at that moment, but again it can be well managed by compression garment. One thing that I really need to mention is St. George's Hospital. They have very, very good lymphedema unit. And if I've had a couple of patients here, but if there is anyone who's had any doubts or wasn't sure 100% whether what they present with is really lymphedema and they would like to be really fully diagnosed with the condition, probably here in London area, St. George's Hospital is the best place to go to have it checked. Yes, I think this was very important to mention. So let me just double check if I haven't missed on anything. Patient contribution, very important, like I mentioned, physical activity, self-lymphatic massage, regular wearing of compression, and skin care. And I think this is all from me. Hold on a second. Yes, I think this is all from me. So I'm happy to answer any questions if there are any.
Well, you have loads of questions.
Oh, do I?
Yes, some I think you answered as you went along, actually. So I'm going to just whip through them because we've only got 10 minutes left and I don't think you're going to get them. So one question is, I've had surgery and some swelling. how do I know if it's just part of healing or something more like lymphedema? I think you did cover that a bit, but if you want to elaborate on that.
Depending on when the operation was, I mean, the time from between 3 to probably even 5-6 months is this period of healing process. So the swelling happening there, it's quite natural thing. But by all means, if you feel like maybe this is prolonging a little bit, or maybe it's very stable, there's no movement, there's no decrease in the swelling, do double check with your oncologist, with your doctor, and go and see lymphedema therapist qualified, because maybe just a little help to lymphatic system, little intervention in a form of lymphatic drainage might be what you need.
And the next question is, why do some people, I'm not going to go back to the people because we're going to just sit through the questions. Why do some people develop lymphedema after cancer treatment and others don't?
Yes, and this is a very good question, and unfortunately we don't have answer to it. We don't. If we knew, we probably would do everything to prevent lymphedema to happen. But yes, this is correct. I sometimes see patients in my clinic who've had only lymph node biopsy, and they present with swelling. And I've had patients with clearance, and they have never had any swelling. Some patients can present with swelling 20 years post this operation. So it's really mysterious for us, but we keep on working on learning more and more and discover what is the solution.
So I've got another question. Is it possible to have lymphedema without visible swelling? What are the early learning signs that you should look out for?
Yes, it is possible. So this is called like subclinical lymphedema, especially with oncology patients. What you would feel as a patient is just different feeling between two limbs. So you would feel like the limb on the affected side is more heavy. Maybe there is some inner pressure, like after all day long being active in the evening, you feel like, I can feel that this is heavier. There's something different. You don't see any swelling, but you feel it. And this might be the indication of your system struggling to drain the lymph from the affected side. And yes, this is how it manifests itself.
I've got another question. I finished treatment and am I still at risk of lymphedema, or does it usually show up straight away? I think you just answered that, actually.
Yeah, no, it doesn't show up straight away. I mean, it can show up straight away, but it may take time long after. The moment there was any interference in lymphatic system, and even the smallest one in a form of biopsy, the patient becomes at risk always, forever, throughout their lifetime. However, lymphedema may or may not appear and happen.
So, oh, hang on, did I miss that question? Is it true that certain skincare products or habits can make lymphedema worse, and what should I avoid?
Sorry, what was the question again?
Skincare products.
Skincare products. To be fair, I've always been a fan of like natural skin products. So when my patients ask me to what I like recommend to use, I do actually send them to. I do have a couple of creams or like either silicone gel, that this is more for scars, but like body creams that I advise them to use, because they are really very natural and probably best to use. I can't really tell them from the top of my head, but if the patient who asked the questions leave an email address, then I'm happy to share this with them.
Okay. Yeah. Great. And the next, oh, hang on. Is that all? I feel like I've missed a question somewhere. What's something you wish every cancer patient knew about lymphedema before it starts?
I wish they knew how to read the signs and symptoms of it. I wish they knew that immediately after having this interference in lymphatic system, they become at risk. And then I wish they knew to be mindful of the signs and symptoms, like I've mentioned heaviness, maybe prolonged aches and pains on the affected side, maybe like during the end of the day, maybe some tightness in fingers or tightness in. If I just want my patients to know that if this happens, they just must know whom to see, because this is the earliest possible time for them to go and see someone, and the best time to prevent like really visible swelling, hopefully.
And then sometimes I feel embarrassed about how my arm looks. Do you have any advice for managing the confidence knock?
The confidence. This is a very good one. I have to say that many patients, unfortunately, their confidence is being like knocked off going through the treatment, etc., the way they look. But I believe there are many charities, really good one, whether it's a cancer research or whether it's a Macmillan, and these organizations are running and probably and these organizations are running a really good like either workshops or webinars, or they organize meetings with like psychologists and specialists. And it's worth to seek some advice from them, because really they have massive amount of knowledge on how to help people who lacks confidence after oncology treatment. So I advise for you to go and look there. I'm sure you will be helped, no doubt.
Okay, and then are there any activities I should avoid?
I would say there is nothing really to particularly avoid. If we're talking about patients who presenting already with lymphedema, activity is a key. Even doing weights, very important to build up the muscle strength in the area. I wouldn't go crazy with, I don't know, 20 kilo to start off with, but starting with like, I don't know, 2, 3, and then build up the strength. Swimming is perfect. Is absolutely perfect for anyone who presents with lymphedema, although not only, but for these patients. I would say really not many activities, and just stay active, really. Do stay active. And if there are any particular questions that you have, do also double check with your therapist, because there are some myths around what to do or what not to do if you present with lymphedema on the affected side. I just quickly mention them. It's, for example, blood tests. I do tell my patients not to use the affected site where the lymph nodes were removed, use opposite one. And it's not because there is any evidence saying you will definitely get lymphedema on this arm, but any trauma again to the skin, any open skin portal for bacteria, we just don't want to add anything to this affected side. So use it on the other side. What I've noticed with my patient, when the weather is very hot, when it's very, very hot, some of them do experience like increased swelling in this time. So based on that, I say if you love sauna, just be mindful of going to sauna for like, I don't know, half an hour. If you love doing this, just give yourself maybe 5 minutes, see how your body reacts. And then, you can take it from there. So I think just don't stop yourself from doing what you like doing, but just be mindful, just take little steps, I would say, and observe yourself.
Okay. And then we've got some nice comments that it's been very informative, so thank you. And we've had, are there any activities activities I should avoid. Did I ask you that? Are there any activities I should avoid?
Yes, it's just this one.
That's what you're talking about. Because I was talking about the conference. Sorry, I was getting very confused. So that's it. So it's absolutely perfect timing. We've got 1 minute left. So I'm going to stop the recording. Please bear with me.